Hi everyone, I'm going to be talking about the usage of Indian home remedies in a Western dominated society. So first, let's talk about what the difference between Indian home remedies and Western medicine really is. Indian home remedies is generally described as the utilization of herbs, spices, and a variation of food to heal and prevent the body from disease and infection. Such Indian home remedies are often prepared in a home setting and are used predominantly in developing countries due to their low cost and high efficacy. On the contrary, Western medicine is the treatment of diseases and infection using drug therapy and is, and is administered in the hospital or doctor's office setting. Drug therapy, though efficient, is also very expensive. However, Western society is able to afford the high cost of such drugs due to the steadiness in their economy. So methods. The difference between the two healing methods piqued my interest in exploring the beliefs of Indian home remedies and Western medicine among Indian immigrants prior to immigration and post-immigration. The project consists of 6 participants, 3 of whom came to the US at around 10 years old, and 3 of whom came to the US after the age of 50 years old. Here are the questions I asked. These are my participants. We have Kamla Devi, who's age 85, Bimsin Munjal, who's age 72, Veena Munjal, who's age 57, Amit Kumar, age 50, Sumit Kumar, age 39, and Komal Kumar, age 38. So why is this important? In the United States, Western medicine is the dominant healing method. However, most cultural groups have some sort of home remedies used to prevent the onset of diseases and infection. In a society where there are many cultures, it becomes important to understand not only Western medicine, but cultural practices and how they may affect one's health. An integration of Western and traditional practices may help to provide quality care for the whole person in a healthcare setting. So in order to accomplish this, I had 3 themes found in my transcriptions. The first theme was Indian home remedies are learnt within Indian cultures and passed down through generations. The second theme was Indian home remedies are used as preventative measures, Western medicine is used as reactive measures. And the third theme, as healthcare professionals in both India and Western medicine societies do not explain patients' conditions. Patients are left to explore their own conditions through their own knowledge. So the first theme, Indian home remedies are learnt within Indian cultures and passed down through generations. We had a quote through my transcriptions from Veena Munjal, who said, "The people in India know everything. The information comes from people on the streets who are knowledgeable about them. Over here, you can't ask people at the supermarkets for such things." And Sumit Kumar, who said, "If there's no science or research to give you some kind of data, then it has to be Southern, because they were thinking and advice passed down from older generations." So some common home remedies found were turmeric, between my participants were turmeric, which is used commonly in milk and food, and it's an anti-inflammatory agent and antioxidant. Cloves, which are used in tea and food, and are also filled with antioxidants to help you fight diseases. Adrak, which means ginger, is also used in tea and food and is filled with antioxidants. And some others that we have are bilvadi, churna, yogurt, shikakai leaves, and fennel seeds. So when asked how they knew about these Indian home remedies, all the participants said they learned it from India or from their family. Indian home remedies are embedded in India's society. India is a country filled with high amounts of poverty. There's not much money to go to the doctors or receive Western treatment. Therefore, residents are forced to figure it out on their own. Residents learn from shop owners on the street, learn from their parents, and learn from their grandparents. Parents teach their children at a young age, and therefore it becomes a norm. Now, as a child grows up and has children of their own, it becomes time to teach their own children. The second theme, Indian home remedies used as preventative measures, Western medicine used for reactive measures. We have Kamla Devi, who said, "Yeah, starting, we try to use Indian home remedies like ginger, honey, and salt. But if it gets worse, then we go to the doctors." There was a consensus between all my participants that Indian home remedies are used as preventative measures, such as herbs and spices utilized in food, as well as it being prioritized in the beginning of sickness with eating ginger to reduce inflammation and fill the body with antibacterial agents to fight infection. However, when and if the sickness got worse, participants claimed that they go to doctors for instant relief in the form of pills. Healing through foods and other home remedies has been embedded in the Indian society, which is what binds the community together in a way. It's rooted in tradition and religion. Gurus teach society medicinal properties found in leaves, herbs, and spices. That information gets passed down to parents, which in turn gets passed down to children. Western medicine, on the other hand, is used for instant relief. For example, if severe pain is felt, using drug therapy might help reduce the pain due to chemical reactions that will occur to instantly block the pain receptors an individual feels. Western medicine is rooted in advances in technology through research, data, and statistics. Hospitals utilize drug therapy for instant relief for their patients. This is generally the case due to the relatively short term stays in hospitals. The last theme, healthcare professionals in both India and Western medicine do not explain patients' conditions. Patients left to explore their own conditions through their own knowledge. We have Kumar who said the patient should be self-educated enough to take care of themselves. Most individuals I interviewed had a pre-existing condition, such as Crohn's disease or asthma. Two individuals that both had Crohn's disease explained that they had to self-educate themselves on their own condition and had to rely on themselves to lessen the severity of their disease. They were forced to navigate through society with their own knowledge. They expressed a lack of return towards the healthcare professionals due to the minimal information provided by such healthcare professionals. Increase in spread of information via technology leads to the better access of information about patients' conditions. However, readmission risks are still high because there's no guarantee individuals will actually follow up with their own conditions. They leave trust to the healthcare professionals, and therefore, when healthcare professionals also fail to inform patients about their conditions and steps to take, the distrust and readmission cycle continues. Implications. So I've presented you with all this information, but how can we actually implicate our understanding into the healthcare system? Some things that can be done are multicultural information during training, whether it be for nurses, doctors, anyone that works in the healthcare system. Cultural humility, the acknowledgement that learning is an ongoing process and a lifelong commitment to attempt to learn others' cultures can be considered a form of multicultural training. One way to successfully accomplish cultural humility is through the process of first identifying your own cultural background and identity. It brings upon self-awareness and respect towards cultures that can be implemented and then understanding others' cultures. The reality is integrating both Western medicine and home remedies would allow care for the whole person. Most cultural groups have home remedies that they use that is different than Western medicine. For that reason, relationship building between the healthcare professionals and patients would allow a safe space for a conversation to be discussed about different home remedies that a patient uses. Breaking the cycle of prioritizing the dominant Western medicine is essential, especially when there are many cultures that reside in the Western society. Efforts to implicate Indian home remedies have been made through pharmaceutical industries working towards using herbs found in Ayurvedic technique to derive natural products into drug forms. However, without fully understanding the roots behind the herbs in Ayurvedic medicine, Western pharmaceutical agencies and industries have been capitalizing on the recent popularity surrounding the mainstream version of Ayurvedic technique. This would include yoga and the vegetarian diet. Therefore, a combination of cultural humility and the multicultural information and training can come a long way in defining new norms for the healthcare system. Thank you. Thank you.